Hey, this is Dr. David Hausmann with Stronghold Health, and today we're going to be going through the top 10 myths regarding chiropractic care. So number one, chiropractors aren't real doctors. Let's go ahead and go through this. In order to become a chiropractor in the first place, a licensed chiropractic physician in all 50 states in America, there are minimum classroom requirements and degree requirements. In order to even get into chiropractic school in the first place, you have to enter with a bachelor's degree. For instance, for myself, I graduated from UNC Chapel Hill with a 4-year degree in biology and chemistry. I knew I wanted to become a chiropractor, and so that was my entry point even into chiropractic school in the first place. And then it's a 4-year program to get your doctorate. So when you're looking at the total length of time, that's about 8 years of education. And medical school is pretty close to about 8 years as well. We actually go through in chiropractic school the same education requirements for a medical student for an MD degree. The main stark difference is very simply in med school, they're going to learn to prescribe medications. So they have to take pharmacology class and they have to take drug interactions classes, amongst others. So they spend a lot of classroom hours on pharmaceuticals and learning how to prescribe medications. With chiropractors, we don't prescribe medications, we work naturally with the body to get the body to heal. With that being said, we end up taking all the classroom hours we would have used for pharmaceuticals and we end up applying that to anatomy, physiology, and differential diagnosis. So truth be told, if you stack up a chiropractor, licensed chiropractic physician with a DC degree next to an MD, we can outdiagnose MDs. And I've seen that in my own clinical experience with patients coming in, being able to diagnose problems that they have where their general family practitioner wasn't able to really give them a solution to it. And it's because we spent so many more classroom hours on anatomy, physiology, x-ray, and differential diagnosis. Also, us as chiropractors, we have to go through the same state and national board examinations. There are licensing bodies that are in place to make sure that we have that same quality level of education and clinical competence. And so just the same way that a medical doctor has to go through their boards, pass their board exams, we have to go through the same thing. Number two, chiropractic care is dangerous. My simplest and easiest response to this is look at what is my cost as a chiropractic physician for malpractice insurance. On an annual, I'm looking at anywhere from about $1,200 to $1,500 for $3 million policy coverage, versus medical doctor prescribing pharmaceuticals can be up to a minimum of 10 times that amount, $10,000 a year. So that alone should tell you safety. My own clinical experience, I've done over 380,000 adjustments and haven't hurt a single person. So in terms of chiropractic care not being safe, I would argue the statistics are far in our favor that it's the most conservative and safest of many of the medical approaches or non-medical approaches to healthcare. Number three, chiropractic care is only treatment for back pain. It is true that chiropractic care is the #1 treatment approach for neck and low back pain. However, with that being said, chiropractic care is taking care of the entire framework of the human body through the nervous system. And so we have patients that we've been able to help with headaches, migraines, numbness and tingling issues, digestive problems, heart conditions, and the list goes on, because at the end of the day, chiropractic is reconnecting the brain to the organs of the body through our nervous system, through the wiring system, if you want to think about it that way. And so chiropractic care is all designed to take pressure off of our nervous system so that our brain can properly send life down our spinal cord, out the nerves, to every organ, cell, and tissue of the body, so that our body can thrive and heal from the inside out. 4, chiropractic care is expensive. I would argue that chiropractic care is one of the most affordable and conservative treatment approaches, especially considering the top 2 reasons that most people end up missing work and having sick days from their job are neck pain and low back pain. Chiropractic treatment is the #1 treatment approach, conservatively speaking, for neck pain and low back pain. There's studies that have been done in other countries and here in America. A Sweden study, for instance, that showed that chiropractic patients had significantly less sick days, less hospitalization, 60% less pharmaceutical costs. And it's because, generally speaking, the mentality of an individual to take preventative and proactive approach towards their health means that they're going to end up having less health issues in the long run. Number 5, chiropractic care is painful. Honestly, my first chiropractic adjustment from my own experience is I didn't even feel it. In fact, it felt like a huge light bulb going off, a huge burst of energy, a rush of oxygen to my brain. And again, in my own clinical experience and working with thousands upon thousands of patients, hundreds of thousands of adjustments, I can't even think of any more than maybe one occasion where I had someone that complained about pain. And that one individual had a hot disc, they were just in a car accident, they had severe trauma that they had just sustained. And so it was working with them maybe a little too soon. We had to wait a couple of days for their body to recover a little bit from that initial trauma. So with that being said, I mean, chiropractic care, like super gentle. We work with kids, newborns, all the way up to geriatric patients. One of my youngest patients was 1 minute old, and one of my oldest patients was 94. And so with that being said, chiropractic care is not painful. I hope that you enjoyed it. If you have any questions, comments, feedback, please go ahead and drop it in the comment section below, and let us know if there's other content that you'd like for us to film, and please give us a thumbs up, a like, and hit that notification button so you can get notified when we have new videos drop.